I'm J.R. White. I'm one of the cardiologists here at King's Daughters Medical Center. I'm here today with Allen Perkins, PharmD, and we're going to tell everybody a little bit about our lipid clinic and the importance of having controlled cholesterol. So one of the most common ways for your physician or nurse practitioner or physician's assistant to treat cholesterol is with a statin medication. Allen, what is a good overview of statins and what do they do for us?
Okay, so statins are just one of the groups of cholesterol-lowering medications that are out there. They tend to be very effective at helping lower our LDL cholesterol, which is our bad cholesterol. They can lower triglycerides pretty effectively, and sometimes they will increase HDL, which is our good cholesterol.
So there is this strange myth about statin medications that they're bad for you, they cause damage to your body. I am here to advocate for statins. Personally, I don't think there is a class of drugs that has been more proven as safe and effective at treating coronary artery disease and atherosclerosis in general. So I'm not sure why the myths exist. The majority of them have been debunked, actually. But as a preventative cardiologist, I want to promote them as much as I can.
Yeah, I think where some of these myths start is if someone has a bad experience with any medication, they tell their friends, and so those they just kind of get passed down along the way. The good thing with the statin is if you take one and you can't tolerate it, sometimes we can switch that to a different one and totally tolerate it, just like you never even have the other one without the same effects.
Any patient that has peripheral arterial disease, coronary artery disease, has a history of a stroke, maybe have carotid disease, or has diabetes, your goal LDL cholesterol is less than 70. So that's a pretty strict goal that we set for these patients, but that number has been shown to prevent future events. So statins are a great way to reach that goal, and then if we don't get to that goal, we actually have some new medications to get us there too, and that's part of the lipid clinic that Allen and I are introducing. So Allen, why don't you tell us a little bit about where the lipid clinic is and the purpose of the lipid clinic in general?
Yes, the Lipid Clinic is located on Winchester Avenue. We're there to help guide the patient through the process of getting them to those goals that you mentioned, with looking at their therapies, looking at their diet, what kind of activity are they able to do, and recommending changes in lifestyle. And then we can look at those medications, see what they're allowed to tolerate, what they're maybe allergic to some things, and we can tailor that therapy to help them reach those goals. One of the new groups of medications that we have to help with lowering your cholesterol is a PCSK9. It's a new drug that's injectable, and two of those, one is called Repatha and one is called Praluent, and they are actually injectables that you would put in your arm, your belly, or your thigh. You can do those twice a month. And they've been very effective at helping reach the goal for your LDL. And then there is a brand new one out that just actually got approved on the market. It's called Leqvio. It is actually one dose every 6 months, and that is given in our infusion center typically. It has to be given in a doctor's office, but it really helps with compliance. It's very effective for long term, and one dose every 6 months is pretty fantastic. And so we can help guide that in the lipid clinic, through those referrals.
I think that's the big benefit of working hand in hand with pharmacists, physicians and pharmacists working together is it helps us know the best way to navigate this and ultimately get the best medication for the right patient. One of the important things that we're trying to make every patient know is to know their numbers.
One of the things that we offer here at King's Daughters is a low-cost blood profile, and that includes a lipid profile. So you can get all of those numbers that you need to take to your doctor. So the cost of that test is only $25, and it's a very low-cost way to get those lab results for you because it is so important. And the schedule for this can be found on our website or on our Facebook page.
Most patients that I see for preventative cardiology have a strong family history of coronary artery disease. For that reason, one of the things that we offer here at King's Daughters is a calcium score. So it's a simple CT scan, and it is $80, doesn't have to go through insurance, and it'll tell you if you have any calcium deposition or plaque deposition in your heart at all. So this is perfect for the asymptomatic patient over the age of 40 years old.
So in our clinic, we also see other patients. And a lot of times I'm asked, how do I get to a cardiologist? What if I need to see someone really quickly and I'm concerned about these numbers? How do they go about doing that?
So our clinic offers same-day appointments, actually. We have clinics from Portsmouth all the way down to Prestonsburg, and we'd be happy to see you quickly.